Hey, John, Nick Kristof in the New York Times thinks Biden can save the white working class. What do you think?
I think it's worth exploring.
Welcome to CareTalk, your contemporary home for incisive debate about healthcare business and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrics.
Well, John, I know how you spent your Valentine's Day weekend reading the New York Times, and I know you read the article by Nick Kristof called Can Biden Save Americans Like My Old Pal Mike? What is that article about?
Well, David, for those of you who don't read on the weekends, Nick Kristof had a really fascinating article, really poignantly painful, about a classmate or his neighbor who had a rough time getting and keeping a working class job, ended up living on the streets. And it was a strangely introspective article for the reliably liberal New York Times, but I thought quite poignant and made a lot of really good points. But you, as a predictable liberal critic, probably had problems with it.
Well, it's a good article, John. It was well written, and I think you always get something out of seeing personal experience. You know, he tied it in with his friend who had problems while he was growing up and then actually ended up, dying at age 55 on the streets from a heart attack, and used that as a taking off point for whether Joe Biden could actually help people like that. So it has strengths because it's very specific, and there's a lot of people like his friend Mike. And I think there's some strengths in there, but it has some limitations as well, John. And I'll defend the liberals. One of the things Kristof said was that, like many liberals with the university education, reliable paycheck, he found maybe he was too scornful of labor, too enthusiastic about international trade, and too glib about creative destruction. And he was too heartless about its toll. So that's his sort of self-loathing approach. And I'm not a self-loather, John. So, maybe maybe he needs to be in therapy.
Well, no, look, I don't think that we're honest about there's a tremendous amount of upside to capitalism. It's the greatest job and career creation vehicle the world has ever seen. But there is no question that we also have, in the last 20 years, sort of ignored the ugly downside that Citizen Trump built up on, the resentment of rural and undereducated whites. But let's be honest, David, they have been paying the price for a lot of other people's successes. You've seen job erosion. You've seen manufacturing jobs leave. You've seen industries get unwound. You've seen, as Ross Perot pointed out, the great sucking sound of jobs to places like in Asia and Latin America. And that costs not just measured in economics, but in healthcare. And you see it in the painful story of Nick's friend Mike, who didn't finish high school, came from an abusive household, and had a hard time keeping a job, keeping his family, and staying sober. But clearly, as reported in the article, had a heart of gold. And it makes you really wonder whether we should be focusing a little bit more on the implications of not having a policy around the things that are basically the prices we pay for a growing economy.
So it sounds like he's gotten around to reading Hillbilly Elegy and putting his own spin on it. Now, there's certainly a lot of parts to that about, despair and so on. I think he goes a little too far. So he talks about, mental illness caused by poverty. Well, sure, there's extra stresses on people who are poor from mental illness. Certainly mental illness causes poverty because it's hard to work if you don't have a job. He gives his example of his friend Mike. I have a very close friend who met a similar, very unfortunate fate. And he actually went to he was raised with a functional home, and he went to a top 10 law school, had plenty of supports, actually had funds. He still ended up on the street because mental illness is very strong, and it's going to overcome what Kristof's thing about the scandal of not having enough treatment for mental illness. Mental illness is going to grab a hold of you at every level, John, and a lot of it is relative. So there's people, who are a little more successful than you, and their own kids are screwed up because they have affluenza. You could look at it at all different areas. So I thought that was overstated.
You're being a little harsh on it. I would agree with you that mental illness is everywhere, and it affects every class, every race, every gender. But there is no question, if you just measure it, Dave, you look at the level of trauma that folks who are poor, who can't find a job, who are trying to live in poverty and emerge, the level of stress they have, and how it directly ties to heart disease, hypertension, depression, and stress. I don't think you shouldn't reject it because it's an incomplete point. You can reject it because that's what you're doing, but I think it's just may have been more imprecisely drawn. But there's no question that if you can't get a job, you're not you can't beat your addiction, and you've got a family that's going to affect your mental health.
John, you pointed out that Citizen Trump, and maybe we won't call him that for so long if he gets stripped of his citizenship eventually, since he didn't have the other punishments assigned to him yet. But if you look at what he did, certainly what he and his cronies have done is recognize the ability to leverage the resentments of this class of people that you're talking about. But I don't think it's the right thing to do. And I think that if you look at, what's he listening to them about trade policy and so on? No, I would say that trade is actually not the cause of job loss. I think you're seeing it's actually really technology, and that what the Republicans have done again by turning against free trade is terrible. And it's been so successful that they basically forced the Democrats along with it. Case in point, the Trans-Pacific Partnership, which we abandoned, and Obama had to abandon it, and Biden's had to stay away from it as well. We're just going in the wrong direction. We're learning the wrong lessons from the suffering that we see.
Well, at least you're admitting to the suffering, but let's think about maybe what is, I think, embedded in Nick's article, but he probably didn't want to state it this way. Look at how in Europe there are actually shock absorbers for people who lose jobs to keep their wages. Look at how Germany and some of the Nordic countries have handled basically having kind of wage gap support during the pandemic, so they don't have everybody works in a restaurant losing their job, losing their income, and going on the rolls. There are some shock absorbers built into the system. I do think that universal health care matters, and access to local primary care matters. I mean, there are some solutions in there where, for example, the European countries have actually built in effectively social policy shock absorbers that can help individuals and families and communities navigate the dislocations that are natural. I don't think you have to be anti-trade to be honest about the cost of trade in some of these communities.
John, I think that one of the things that Kristof didn't say specifically, but that I endorse, is that empathy is an important part of policy, and recognizing that people have challenges and you shouldn't have harsh punishments on them is a good idea. The European example, I think, is too much coddling. And in fact, there is something to the kind of the American rugged individualism approach and ensuring equality of opportunity. So, for example, in Europe, they don't do a very good job of absorbing immigrants. One of the reasons is that they load them up with social services. They never really get integrated into the economy. What we're trying to do here, and I think what you're actually seeing in the US, is actually a shift toward multi-ethnic democracy. And that's pretty hard, and it's being resisted mostly by the Republican Party. But what we should actually have is more immigration, because I think the immigrants are actually people that, yeah, they have these challenges as well. But guess what? They go and they work hard and set a good example. And we should have more democracy, too, so that we don't have the Senate representing people they shouldn't. And we should have DC statehood, John. That's my number one suggestion here.
The whole point of this conversation was what we agree and disagree with Nick Kristof on. Now you're throwing your own immigration and democracy agenda at it. Can you just stay on point? What do you think he got wrong?
Well, he didn't talk about Europe. He knows to stay away from that one. So I think that one thing that he got wrong was this big focus on how we needed to have a big expansion of kind of, mental health care and drug treatment programs. I think that's you're wasting money there. So, John, on drug treatment programs in particular, to give something that we know a little bit about from the way the healthcare world works, as soon as you start expanding those programs, then people find ways to charge $2,000 every time somebody comes in for their drug treatment to test them for drugs. I think that's throwing good money after bad.
Well, I think you're making a really interesting point, because I don't think what Nick gets is that there's the current drug treatment centers. He wants a massive expansion, and it is criminally stupid that only 20% of people who want drug treatment can get it, and it's even fewer within our prison system, which has its own weird compounding. But the private and the near private public solutions for drug treatment have an 80% plus failure rate. So I think we do need more support there, but we need programs that work. And if you look around, you can find them, but it's just not currently what we pay for. So we've got we pay a great deal of money to a small group of facilities that do not such a great job. And so that's clearly an area where we need to kind of reinvent the solutions. But look, the deaths of despair are on the rise, David. You've got if you look at working class whites, there's the category that gets a lot of attention because it supported Citizen Trump, and it's where a lot of that resentment is catalyzed. Their life expectancy goes from 50 years old to nearly 80. If you look at it from 1900 to the end of the last century, and it's actually reversed. We've got life expectancy declining in working class whites, and deaths of despair, opioid abuse, death by hanging and shooting, alcoholism, and those are the ones that are easy to measure, are increasing pretty radically. And that is the direct cause of that decline in mortality, which is defined by whether you have a four-year college degree. So I also think that we've got to figure out a way in many ways, it would sort of suggest that getting education right and getting wages right can have a bigger impact on healthcare in these communities than, another healthcare policy recommendation from people like you and me.
So, John, since I bashed Europe before, I'll reward them here. So, you say that having a college degree is a good thing. Part of the problem, though, with college in this country is it's very expensive and people come out with a lot of debt. And sometimes they come out with a lot of debt, having wasted time, and they're not improved. In some places, like in Germany, they actually do more vocational training, and that might be a good idea. There's a need for tradespeople here in this country. There's a labor shortage there, so that might be an approach to take. One thing that we haven't talked about so much is that this article is very much about President Biden and him being the right person for the job here. And I think I'll see what you say, but I agree with that, because no one can call him a crazy socialist, or they can't. That's just not convincing when people do. He has certainly his own upbringing and hard times, both as a kid, with his dad being in this working class category that you describe, and certainly the tragedies that he's had in his own life. And he points out that, Kristof points out that Biden didn't do stupid things like, saying, defund the police. He's got a much more nuanced view of it.
Well, I think Biden's a really interesting example because his father was a working class dad who did lose his job, had to travel around to find a job. But the jobs that his father found and lost are not the jobs that are available to someone without a college education today. And I think that's there's a real challenge there. I mean, what did you think of well, while we're picking at Nick Kristof, maybe we should get at what did you think of his big five ideas?
Well, I think the big five is good, John, and that's something from World War II or something like that. But so he had five things. Well, let's just pick them off one by one. So the first one was about high quality early childhood and daycare program that's modeled on what they have for the U.S. military. Now, John, I'm a big proponent of early childhood interventions, because I think in the first couple of years of life is really where equality of opportunity comes in. And so, boom, I'm big on that one.
Well, I think it's really hard to argue with babies wrapped in flags. And so that one's, I totally agree with you that is the probably the single greatest opportunity. And you see it in the universal support for Head Start, but hard to agree to disagree that a better start wouldn't be better for kids, and no one can hold it against some poor young kid who wants access to early childhood education and daycare.
But John, to be fair, yes, it's kind of motherhood and apple pie, almost literally, but there hasn't been the support for it. Actually, it hasn't actually come through. Those things haven't been funded that well. So it's not just sort of saying, yeah, we're in favor of that. No, it's a real commitment of resources.
But it's one that it's really hard to get people to disagree with. And I love the fact that he brought in the vets. Well, what about, I mean, I'm pretty clear that the minimum wage needs to get to 15 or better, but why haven't you been more public about it? I mean, clearly Kristof thinks that a higher minimum wage would be helpful, but what do you think?
Certainly, John, I studied economics in college, not quite as a prestigious college as where you were. And you certainly said there's a trade-off. If you have a higher minimum wage, then you're going to have more unemployment. I think what people have realized over time is that actually, first of all, the minimum wage is so low now, you can't really live on it. And if you have a higher wage, I think it's a good thing. It will bring people out of poverty. And also, you know what? If you pay more for something, you respect it more. And the same is true for paying for people's labor. And so it's actually going to improve the dignity of work by employers having to think hard about how do I make sure I'm not wasting somebody's time. They have to be able to be effective if I'm paying them more. So I'm all in favor of it, John.
Well, other than correcting you for the false trade-off, that if you increase wages a little bit, you can't take costs out of elsewhere. I mean, that's a silly point. But the other interesting point or a simply narrow mechanical view of it. But he also talks about scaling up proven initiatives like Year Up, which are basically apprenticeship programs where people get a chance to who from a rough or incomplete educational background, the opportunity to kind of grow into a job at work. An apprenticeship is something that was true a couple of hundred years ago. You probably remember that, Dave, during the Ben Franklin era that you grew up in. And Europe, that's right, but we should invest in that.
Yeah, I actually had an internship with Ben Franklin making kite strings. So it was, I'll tell you about that at another time. Now, the next one I already told you I think is a stupid idea, which is the huge expansion of drug treatment programs. Forget that. That's a big waste of money. And it's a further transfer of funds into the healthcare industrial complex. I'm against that, John.
I'd spend the money if we could get it right. But in right now, I agree with you. But what about child, the Biden child allowance? What is it, about $350 per kid per month? That is an emergency part of the emergency stimulus of President Biden. I know that you're kind of stingy actually with allowances for your kids, but what do you think of Biden's more generous investment?
Well, so if it's $350 a month, I guess that's going to be $351 for my kids because, they currently get about 25 cents a week. I think that this is actually, I don't think it's really a great idea, but I actually think this is an example of Biden being savvy. So rather than calling it like a transfer, income transfer or something that looks like it's a socialistic thing, you focus on what's happening. It's not a transfer from old to young or from, rich to poor, but it's a childhood and it's allowance. It's a good thing. I think it's good marketing. They should say a childhood allowance, just like the military gets an allowance.
And bandwidth for all, your favorite. I know that you're sort of a technophile. What did you think of that?
Well, John, so people compare it with like the Tennessee Valley Authority rural electrification project. The truth is, remember when people were saying, I got to get my son a computer or my daughter so that they can keep up in school? Bandwidth for all is just going to mean more looking at TikTok and Facebook and other nonsense. So I think dial-up is good enough for people.
You're too much of a cynic. I think it's essential that we have universal access to bandwidth. It's proven absolutely critical during COVID. Digital first is going to be more of an issue going forward. Everyone needs to have access to technology and bandwidth, particularly at a time when we're trying to turn around parts of these communities. And I think that what this comes down to, and it reminds me of the sainted Senator Moynihan's point, that we need a national family policy. The breakdown in these communities, the breakdown of some of these core elements of citizenship, being able to work a full 40 and get paid a living wage, that's elemental. Making sure people have the money to pay for their kids, that they've early childhood education. That's elementally about a family policy. And if we could kind of frame it that way, I think we'd get much more buy-in. We would even be able to get in a red state or blue state policy. It might actually be a red, white, and blue policy.
Well, John, speaking of bandwidth, I've about hit the cap, the length of this episode, and I'm sure our listeners have as well. I don't want Comcast or anybody else to be, T-Mobile to be charging anybody any overages here. So I'm going to say we wrap it up now, John, and say that's it for this edition of CareTalk. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. If you like what you heard, please subscribe and leave us a review. Thanks for listening.